My name is Joni Brand. I'm a registered nurse and I'm the program director as well as one of the instructors here at WANIC, Washington Network for Innovative Careers, on the Lake Washington Institute of Technology campus here in Kirkland. Our co-instructor is Allison Terwilliger, also a registered nurse. I have been here since the opening of the Allied Health Building, which provides us with our state-of-the-art classroom and nursing assistant lab that you can see around me. I remain excited for our mission. I have been a nurse for all of my career after graduating from the University of Missouri. I cared for patients across the continuum, from prenatal and postpartum, neonatal intensive care, physical medicine and rehabilitation to include spinal cord, traumatic brain injury, and stroke patients. I also worked in various outpatient clinics and in school nursing. Now I combine those nursing experiences with my passion for teaching high school students. The Health Science Careers coursework requires half of a student's academic day. 3 credits are taken either in the morning or afternoon for all 5 days of the week, Monday through Friday, on this campus. Students must be able to provide their transportation from here back to their home high school or from their home high school back here if they are in the afternoon class. We provide high school students the opportunity to get a jump start on their careers, exploring whether health science careers are a good fit for them while earning high school and college credits at the same time. Additionally, students may become a nursing assistant certified. This means that students have completed a state-approved program, which WANIC is, having met a mandatory amount of classroom and clinical hours fulfilled during the school year. The clinical hours are met by working closely with the supervision of a licensed nurse in the care setting. This provides students the opportunity to take the skills that they have learned and practiced in the nursing lab to the nursing facility and provide care to patients or residents. The care that nursing assistants provides relates to assisting with activities of daily living, known as ADLs, that are expressed by state law and guide the scope of practice for nursing assistants. The ADLs may include such skills as dressing, feeding, assisting with bathing, and toileting. Health Science Career students earning their certificate also help patients with their mobility, helping them to walk or to get in and out of a wheelchair. They learn how to take vital signs and what the normal range of vital signs are. They learn to observe and to report their observations. They practice written and verbal communications. Nursing assistants provide over 90% of patient care and represent the largest group of employees working in healthcare today. Once students have completed their hours successfully in the spring, they may be eligible to take the state written and skills test and become nursing assistant certified. This course provides an amazing opportunity to check out healthcare, experience providing patient care, and prepare for employment. Once students have successfully tested, they may go to work immediately. We also explore other opportunities in this field, such as expanded roles in nursing, medicine, biomedicine research, physical, occupational, and speech therapies. Nursing programs today are competitive at the college level, and often this experience enhances students' applications. Our facility is state-of-the-art. Our nursing lab has 8 hospital beds and mannequins for students to learn the skills for patient care. It's set up as if it's a nursing care unit with a nurse's station. There's a training toilet, clean linen and dirty supplies. Students have the opportunity to be in the role of a patient for their peers to practice their skills. In the classroom, students are provided a laptop to work on. We use an online curriculum, Health Science 21, to enhance students' learning. Student learning also includes introduction to electronic medical charting, which is a part of health informatics, a growing profession in health careers. If you have any questions, please ask. Visit our WANIC website for our contact information and sign up soon. Seats do fill up and are limited. Thanks so much for your time, and I look forward to seeing you in class soon. Bye now. So here's our classroom, A308, where we work with the computers, prepare for our opportunity to be in the lab. Just across the hall, A309 is our nursing skills lab. Students come in, hand sanitize on their way in. If they have a coat, they'll park it here along with their cell phone. Sign in here, check themselves off that they are prepared for the day, and then I'll show you the rest of the lab. Okay, we have bed 1, bed 2. Our beds are hospital beds, fully operational. Bring them up for making. Raise the head of the bed if you are feeding someone. If you are dressing them, you would want to provide privacy. And then the most important thing, always, if you're leaving a room, to assure that the bed is low and the bed is locked. We have mannequins that we practice some of our skills on, and when we leave our patients, we make sure they have their call light. The lift above this bed, and then we have another 2-person lift around the corner here that I'll show you at another bed station. Two-person lift that we practice in the lab before we go into a care facility and actually assist residents from getting out of bed, assist them to get onto the toilet, assist them to take a shower. Each bed, or 2 beds adjacent, have a place to wash your hands. When you come into the lab, you would check here to see what bed you're working at, who you're working with, and what skills you're working on for the day. If it's something new that we need to demonstrate, we would have a demonstration before the class. We also have a debriefing room where we can meet before class if we need to, and also debrief after class, how things go. Again, another mannequin. We have a training toilet, instructional toilet, where students can take care of some of their dirty supplies. Then this is our nurse's station. Again, another place you can wash your hands. Computer is here, copy machine is available. Again, when you walk in, you'll have a notebook that will include what work you're doing for the day related to the bed you're at. And last but not least, soil linen, soil supplies. And additionally, when we're very busy, we will use this as a second toilet. So students will have their dirty supplies here, and at the end of the day, supplies will be sanitized, put away here. Dirty linen is picked up, and the actual chores are completed by students before they leave for the day. When they leave, they will sign out. That's our nursing lab. Very much state-of-the-art, very much opportunity to learn what it's like to be in a care facility. Thank you for your time. Again, here we are at Lake Washington Institute of Technology, the WANIC Health Science Careers Nursing Assistant Certified Program.